Um, Chairman Anderson, would you mind starting us off in a word of prayer?
Let's pray. Dear Heavenly Father, just thank you for this beautiful day you've given us, dear Lord. And dear Heavenly Father, we just ask you to give us the wisdom and knowledge to make the right decisions for the great people of the great state of Georgia. Dear Heavenly Father, we just ask you to watch over our families as we're away from them. Dear Heavenly Father, we just want to pause and just thank you for loving us. Dear Heavenly Father, forgive us of our sins and thank you for our wonderful blessings in your name's sake. Amen.
Amen. Thank you, Mr. Chairman. So we will call this thing to order here, and today we have on the agenda, this is a hearing only, but I wanted to learn more about it, and I wanted the committee to learn more about this issue, so that's why we tried to set it up where we could have the entire hour to learn about this. And so my good friend Senator Harrell, you have Senate Bill 278, and would you like to the floor is yours, and I will turn your microphone on, so go ahead, my friend.
Thank you very much, Mr. Chairman. This is actually my first time to ever present to an ag committee, which is a little odd because I'm a city girl. I was raised a city girl, so why am I bringing what I've nicknamed the corn bill? Because I'm from Indiana. I grew up with seeing huge fields of corn, so I'm actually very comfortable with corn. So what we have is the committee substitute to Senate Bill 278. The LC number is LC 600143S. What this bill does is simply calls, yes.
Just one sec, my friend. What did you say the LC number was again?
Hopefully I have it right. LC 600143S.
Okay. I think, yeah, we've got LC 600085. Just hold on just a second. We'll get some.
Okay. Do you want me to take a quick look at what you have?
Yeah, you can just keep going, and don't you think, and we'll get everybody a copy of the sub.
Because I want to make sure that I don't have the wrong one.
No, you got.
This is not a sub here.
Oh, it's not a sub. You have the bill.
No.
Okay.
Yeah.
Okay.
It'll just take it.
You'll
it'll
get the
take us
sub.
just a second.
Okay,
Yeah, but
you're gonna
go
get the
ahead
sub.
because I know we've got speakers and.
Okay.
We'll.
All right. You will have the sub in a moment. So simply put, what this bill does is it calls for the fortification of corn products to be fortified with folic acid. This is a bill that a constituent brought to me, and he heard about it through the Rotary Club, which is this is how legislation is supposed to happen, right? A constituent is supposed to bring a piece of legislation to their senator. What my constituent didn't realize when he brought this legislation to me is that I was formerly the executive director of the Healthy Mothers, Healthy Babies Coalition of Georgia. And 2 decades ago, when I was their executive director, I remember a big initiative to fortify wheat products with folic acid. And the reason we did that was to prevent the development of spina bifida as fetuses are growing and developing. And it turns out that that women of reproductive age, if they have adequate amounts of folic acid in their system, that this does prevent the development of spina bifida, which is a neural tube defect. It affects the development of the spine very, very early in the pregnancy. So you want the pregnant woman to have this, or you want the woman of reproductive age to have this in her system even before she gets pregnant. So I knew about this effort 2 decades ago. So when my constituent brought this issue to me, he said, we need to do the same thing for corn because the Latino community has a corn-based diet, not a wheat-based diet. And so they're not getting the benefit of what we did 2 decades ago. And it just made perfect sense because I remember doing that 2 decades ago. So what we're going to do today is I've gathered together, I believe it's 5 experts. They're going to each they all have a little bit of a different knowledge base, and they're each going to take 5 minutes to share with you their lifetime of expertise, and then we'll have plenty of time for questions.
Good deal. Thank you, Senator. Who's up first? if you don't mind, when you take your seat, just for posterity and the record, state your name and who
Sure.
you're with.
Yeah, my name's Jacob Leopard. I'm a pediatric neurosurgeon here in town. I work at Children's Healthcare of Atlanta. So, Mr. Chairman, ladies and gentlemen of the committee, thanks for having us today. It's an honor to be here talking to you about this. My job here in town is to work on a daily basis with the children of Georgia who have this disease that we're talking about. And I also work with their families and get to serve them. On top of that, I've worked with and helped found an international organization called NeuroKids that helps train neurosurgeons in other countries to treat this disease. So it's a topic that's very near and dear to my heart. I'm very passionate about it. We have an excellent lineup of experts here today. The goal is to give y'all the facts on this topic so that y'all can make an informed decision on this bill. My role in this is to give you kind of an idea of what it means if you have a family member or a child who has this diagnosis. What does that look like for you and for your child? So just to kind of give the 30,000 foot view, spina bifida sits within a larger category of diseases that we call neural tube defects. Basically what that means is they are malformations of the brain and spine. When we say spina bifida, that's a very specific disease within that category. But what it means is that the baby's spine isn't formed properly. So in the womb, it's a tube that's supposed to close, and then that becomes the spinal cord, spinal canal. Babies with spina bifida, that closure doesn't happen, and so they're born with the inner contents of the spinal canal open, exposed to the skin and the outside world. So there's injury to the nerve roots, injury to the spinal cord, and we know that most of those kids have significant handicaps for the rest of their lives. So in a major study, about 20% of those kids were able to walk in their community without assistance, without wheelchairs, braces, crutches. 80% of them needed help, so significant physical handicaps. On top of that, we know that about 80% of them also develop a separate but related disease called hydrocephalus. So that disease involves a buildup of fluid on the brain that makes us have to go in and put in drains. Those drains can get clogged, and it's something that we live in for the rest of their lives. And so, you know, the picture that I hope I'm painting is that these kids are lifetime consumers of the medical system, and they're chronic consumers of the medical system between just the physical handicaps, the hydrocephalus, the emergent surgeries for...
Yeah, I apologize.
Stand up and dance at least one.
Yeah.
I like the ringtone.
So, little Elvis for you today.
all right.
That's not the first time that has happened. I apologize. Go ahead, carry on.
No problem. So the point, though, is these kids are really sick, and they stay sick for their whole lives. And so if there's a way to safely prevent this disease, we should consider it. On top of that, you know, just from the global health perspective, we know that if an adult has a handicap, that takes one person out of the workforce. If a kid has a handicap, it takes two people out of the workforce, not just the kid, but their caregiver. We've seen studies where marriages, where there's a baby with spina bifida, they have a divorce rate upwards of about 50% because of the financial strain, you know, just the emotional toll that takes having a child with special needs. So there's a huge effect on society at the macro level, and then at the micro level, an effect on families too that we're working with. All of that said, it's also important to see this current bill within the context of the broader folic acid fortification movement. What we're proposing isn't the implementation of something brand new that's never been done before. It's actually the expansion of an intervention that we already know works and that we already know is safe. So in the 90s, we fortified our wheat with folic acid, and we as a neurosurgical community saw the rates of spina bifida plummet. That only works, though, if you're a people group that consumes a lot of wheat. So the people who get missed in that are the Hispanic populations. And so that's the bill that we're talking about today. We're effectively spot welding. We're filling in a gap that the current folic acid fortification doesn't fill. And so the goal is to hopefully have a few kind of front runner states pick this up. California's done it. Alabama just last week passed committee with a very similar legislation. There's another bill in Tennessee and in Florida that we're hoping to move forward. So the goal is if enough kind of front runner states, hopefully southern front runner states, can pick this up, then the major producers will just kind of make a blanket change as opposed to having to, you know, make something for Georgia, something else for Minnesota. So that's kind of the strategy in this. But, you know, to conclude, I'm a strong proponent of the concept that an ounce of prevention is worth a pound of cure. I love my job as a neurosurgeon. I love working with these families, working with these kids, but I would love to work myself out of the job preventing disease if at all possible. There's a lot of things that I see that we can't prevent. We don't know how to prevent brain tumors. We don't know how to prevent skull malformations. But we know that seat belts and helmets prevent head injuries. We know folic acid prevents spina bifida. So we should do those things if we, if at all possible. That said, I hope I've given you an idea of what life with spina bifida looks like. I'm happy to answer any further questions, but I'll now pass it off to our next set of experts.
Let's see here. I have a quick question.
Yeah.
Just how many children in Georgia do you know are diagnosed with spina bifida every year?
That's a great question. So at current birth rates for Georgia, I would guesstimate between 40 and 60 children per year. That number is probably going to fluctuate depending on who you ask, but it's around that. And so we know that the Hispanic populations have the highest rate within that, but it's about 40, 50 kids a year. We also know that for every kid who's born with spina bifida, they're going to be, like I said, lifetime consumers of the healthcare system. It's millions of dollars per child that's the cost to the healthcare system to take care of them.
We got some more questions. I think that is Chairman Watson.
Thank you, Mr. Chairman. When you mentioned the wheat, was that done by the feds, or did it start out like we're doing here today, or how did that get implemented where we started doing that with wheat?
That's a good question. If you will let me defer that question, we have another
Okay.
panelist who's going to come up and go into detail on the history of folic acid fortification.
Okay, all right, thank you.
I have Chairman Anderson.
Jacob, I just got a text from a gentleman that I grew up with that says you is his son.
That's correct, sir.
Thank God for your mother, because you did not get all this from your daddy. I can tell you that.
I don't know if you remember, but you and I had barbecue at Homer's Field
Almost
about
did.
10,
You better
15 years
believe it,
ago.
buddy.
Yeah,
The good old days.
yeah.
Do you have any you answered part of my question was how many states already do this. Do you have any other do you have any connections in Tennessee that maybe you could get the bill passed in Tennessee,
We certainly, yes, we do. I mean,
like your daddy?
yes, sir. Exactly. Yes, sir.
Yeah. Committee members, just to let y'all know, his daddy played at dadgummit, it just went blank.
UT Chattanooga.
Chattanooga football, sure did. Great guy.
You remember the good old days?
Oh yeah. But anyway, so what? On a serious note, how many states already do it?
Currently, right now, just California.
Just California.
We're working to change that.
Okay. All right. What? Do you have any impact of how many children this would help in the state of Georgia?
So if you go with the guesstimate of 40 to 60 kids per year born with myelomeningocele, I would say, you think a quarter, 10th would be born that are Hispanic of that category? So we're going to guess and say per year, 6 to 10 kids. But
How many?
6 to 10 kids per year. But, cumulative effect over time, that adds up. And if you think about cost per child over the course of their life in terms of healthcare usage, that also adds up very quickly too.
And if this happens, would it be a very costly to the family, or would it? I mean,
So if you have a child with spina bifida,
Right.
absolutely, absolutely. So, to go into a bit more detail, when the baby's born, they have to have a surgery within the first 1 to 2 days of their life to close
Okay.
the defect. 80% of them will have surgery for buildup of fluid on the brain. They'll have to catheterize to urinate for most of their life. If you have a surgery for fluid buildup, you often have multiple surgeries over the course of your life, and then wheelchairs, crutches, special needs equipment. It adds up a lot. On top of taking a caregiver out of the workforce, losing a spousal income within a family, it's
Right.
yeah.
Okay. I'm proud of you.
Thanks. Appreciate that, sir.
Thank you.
Oh, thank you, Mr. Chairman. I've got a quick question before we go to the next speaker. If we, if all of the corn products were fortified with folic acid, would it stop? I mean, you understand what the question is?
Yeah, we know that with adequate fortification, we see the rate drop by about 70%. So it doesn't go to zero, but it significantly diminishes.
Okay, I think we've got Senator Kemp here with a question.
Yeah, I'm curious if there's a way to know, like, how long does a mother have to have this inner system in order to prevent spina bifida from occurring?
Yeah.
Like, how long does corn have to be fortified for it to make an impact?
For sure, that's a great question. We're going to go into more detail about the moleculars of that with our next speakers, but to briefly answer it, it has to be in her system long enough to raise her folic acid level. So, and we want that to be done within the first 4 weeks of pregnancy, which most people don't know they're pregnant during that time yet, which is why it's important for people to just be getting it in their diet. So, but I would expect, you know, if a mom is susceptible to having a baby with spina bifida, if she is taking the supplement or eating corn with fortification within a few months, I would say that would be fast enough to see the level rise.
All right, do we have any other questions from Jacob? All right, Jacob, we may call you back up here.
Sure.
We're going to move on to the next.
Yeah.
Let's see here. How about, is it Helena? Yeah, who would like to go next? Okay, good deal. Mr. John? Yes, sir. John Yeager. All right, good deal, Mr. John. The floor is yours.
Good afternoon, Mr. Chairman and esteemed ladies and gentlemen. I'm going to talk briefly a little bit about the costs and the savings associated with preventing this horrible disability. My grandmother used to have some favorite sayings, and one of them was, "A penny saved is a penny earned," and another is, "An ounce of prevention is worth a pound of cure." And that's certainly the case with preventing these neural tube defects. Just briefly, I'll give you some numbers, but the return on investment for preventing spina bifida is 1 to 48. And to give you some idea of the actual numbers, these are mostly from the Spina Bifida Association, and they are Georgia numbers. In general, fortification costs are very low. The cost per 30-count bag of tortillas, and we'll have some folks with some show and tell to show you what that looks like if that's not something you buy. It's about 0.03 of a cent. And the cost per a 4-pound bag of the flour, if they're going to make their own things, it's about 0.18 cents. So that's about 1/5 of a cent. And the cost per 100-pound for the manufacturer is about 4.4 cents. So it's really fairly trivial. The annual cost of providing folic acid per person for Corn Massa products to prevent these diseases is about $5.79 per year. Now, the cost of lifetime care for individual spina bifida patients, and this is the Spina Bifida Association, and some of these numbers are a little bit old. In other words, the cost is more than I'm going to quote here. It's somewhere between $901,000 to $1,417,000 per person per lifetime. And this is the number I think is worth focusing on. The estimated cost of lifetime care related to spina bifida for the 5,287 people living with spina bifida in Georgia ranges between $3.36 billion and $5.28 billion. And the source there is the Spina Bifida Association. Well, somebody has to pay these costs. And a lot of times it's the state has to bear the burden of taking care of these children. So from a purely economic standpoint, it's incredibly worthy investment. And not only you're investing in the reduction of expenses, but you're investing in reducing suffering.
Good deal, Mr. John. We have number 12 here, Chairman Summers.
Mr. Chairman. Mr. John, walk me through this. Make me understand something. And I'm trying to follow along with you. I'm trying to do a little research as I go. And I remember folic acid, studying about it. It's as a B vitamin, vitamin B9 and whatever. Isn't there a vitamin supplement? I mean, you're talking about $5 per child or whatever. I mean, kind of walk me through that about the difference in vitamins versus corn chips and those type things and mesh.
Okay. Well, to kind of go back a little bit, since about the 90s, this vitamin B9 or folic acid has been a part of flour that you buy. And so the women in our families are getting the benefit of that without having to go get a pill. Problem is that in the Latino community, their diet's primarily corn. And corn has never been fortified like that. Only 6% of corn products are fortified. So that has not been fortified to the extent that wheat has. So the cost of adding this little vitamin, all you need is a very, very small amount, is fairly minimal, and that provides protection for a woman of childbearing age. And it's really great if you can put it in the food because they don't have to think about, I need to take a pill. And most people, well, maybe not most, but probably most people may not even know they're pregnant until the period of safety is passed.
Where'd the $5 deal per?
That's the cost to a manufacturer. For some, this is if somebody's all the corn masa products that they eat for a year, all the tortillas, all the chips, everything to fortify all the food that one person eats for that year is less than $6 per person. Does that?
I got you. But I'm trying to figure out how we would sprinkle that on the food for them. I'm trying to make how not be everywhere, not be in every other state. We just do it here. How does it get there? How do you get there?
How do we come up with a 579?
Yeah. How did you get there? I mean, how do you?
I don't have the equations, but that was data that was provided by FFI. They have a representative, the Food Fortification Initiative, and they have a representative here. But it has to do with the amount that's necessary to prevent it, which is like 400 micrograms, I believe, per day, and then multiplied out by the pounds of corn that they have. And
so you're saying that probably, Mr. Chairman, if you will, you're saying that making sure I'm on the same sheet here with you, that they might not remember to take a vitamin B9, and if you have it already in the food, you've solved the problem.
Exactly.
But if you don't put it in their food, we need to do an education program on them to remember to take a vitamin B9, I'm assuming.
Well, it's just what we found.
I don't know.
It's just a whole lot easier to put it in the food than no one has to be conscious of it. Just by eating bread, they're getting the benefit. And problem with education programs, they don't reach everybody. And I'm okay.
Listen, I know where you're going with this. I guess my next question would be, the next step, Mr. Chairman, if you will, my next follow-up question would be, I don't want to get caught in a trap where someone else walks in here next year and we got to put this in the food and this in the food and this in the food. I don't want to get caught. I mean, you shake your head. Yeah, I just didn't want to get caught in that trap. I mean, I realize what you're saying is probably 100%. That's where I was going with it.
Well, I think that folic acid deficiency is fairly a unique problem. I don't think anybody's going to come and ask you to put, iodine's already in salt. I can't think of any other nutrients that
vitamin
Americans
C, it
aren't
goes
getting.
on down the line. Vitamin D, vitamin C, all these things go on down the line,
All right, my board's lighting up,
Go ahead.
Mr. Chairman. If you don't mind, do you have another question or? Okay, I'm just.
Go
I
hope
ahead.
I answered it.
Oh,
Okay.
Yeah. Chairman Walker.
Thank you, Mr. Chairman. Are there so this is sort of along Senator Cardin's questioning, I think, other sources of folic acid in the food, is it in milk?
It's in leafy green vegetables such as spinach as a source, peanuts as a source. The problem is that if you cook it, that makes it ineffectual. But mostly it's in leafy green stuff. It's in brewer's yeast.
Not milk.
Not milk.
Okay. How long since the California legislation has been in effect? Because a lot of times, that's such a huge market, a lot of times manufacturers will do what they got to do to comply with California so they don't lose that market.
Sure. I think it's fairly new within the last year or two. Is that right? There are nascent there are other states that are working on the same legislation.
Do we know, does anybody know when California passed that, or?
No, everybody else is in process as far as I know.
I believe we have a speaker that can answer that next, maybe.
The bill for California was signed in September. It's coming into effect in 2026.
Okay. And my last question, because I'm ignorant about all this, 2 more questions, if you don't mind, Chairman. I'll try to be succinct and just want to answer. I don't want any elaboration because we're running out of time. Are there any allergies, known allergies or side effects from folic acid?
No.
Okay. And I think you already answered this one. I believe you said you thought it was in 6% of the corn products currently.
Yes, sir.
But with California passing it, I would expect that to drastically increase, I would think, that huge market. But thank you, Chairman.
Yes, sir. And I apologize. I don't know. It all went to lighting up at one time, so I don't know who was first. I believe it's Senator Sims. Senator Eccles. I'm sorry.
Thank you. So I looked online right here, and so Canada already has this. It's mandatory, right?
I'm sorry?
In Canada, this is mandatory.
Do you know? I don't.
So there's actually kind of a technical...
I'm sorry. One of the things I've just asked by Senate Press is if you're gonna answer, could you come up and speak into the mic for?
I can wait until. Or are you speaking later?
Okay.
I can wait until.
Okay.
Then. It's fine.
Is that okay? Senator Hatchett.
Thank you, Mr. Chairman. For corn mesa, how much is actually produced in Georgia?
How much corn masa is produced in Georgia?
Mm-hmm.
I don't have that figure, but I think the next subsequent speakers can address that.
Okay, because
Don't forget the question.
Well, yeah, my follow-up to that would be, from what I'm reading, a majority of it's produced in Mexico, and how we would enforce this on Mexican imports.
I'm not an expert in that, so I'm going to defer. But
Yeah, we're gonna.
I
think we've got someone that's going to answer
All
that.
right, I'll yield.
Senator Kemp, and I think
My question may have to wait too. My question one is how does a company know that their product is coming to Georgia, and how would we regulate that? So that's one. Maybe that'll come up later. And then second, what is the percentage of diagnoses that we get? You said 40 to 60 per year are Latino children.
Well, just in general, Hispanics experience 14% more cases of spina bifida and 34% more cases of anencephaly, which is being born out of the brain. That's the ratio, or that's the percentages. As far as the numbers go, I think we mentioned 40 to 60 kids in Georgia.
Yeah, that's total, right? So you're saying about 4 or 5 are Hispanic. Around a little more.
Probably something close to that. Yeah,
okay.
Maybe a little higher.
Got it. Okay, thanks.
all right. Thank you, Senator. Do you want to come up next and if you don't, yes, sir. Thank you, Mr. John. We appreciate your testimony. If you don't mind, when you take the seat, just for the record, state your name and organization that you're with, if you don't mind.
Absolutely. Good afternoon, Mr. Chairman, members of the committee. My name is Sharon Bustrak, and I'm a technical advisor with the Food Fortification Initiative. So I help plan, implement, and monitor food fortification programs. I've spent the last 2 years researching corn masa and the benefits of corn masa fortification. I do want to note that today my remarks and answers reflect my own views and not the views of Emory University. I'm here with a little bit more information, technical information, on what corn masa is, what we use it for, and why it makes sense for it to be fortified with folic acid. So corn masa specifically is made by taking corn kernels, cooking them with lime, and then stone grinding that mixture. So this resulting dough can be made into many products. The most famous one would be corn tortillas, but we're also talking about tortilla chips, tostadas, tamales, many other products like this. So these foods have been, of course, gaining popularity in, I think, all population groups in the U.S., but they're a traditional staple in many Hispanic or Latino households. So as was mentioned, in the U.S., we've been fortifying enriched wheat flour for over 20 years. It started in 1998. And we've seen since then that decrease, right, in the neural tube defects like spina bifida that Dr. Leopard mentioned. Because the way that corn masa is made is different than how wheat flour and actually some other corn products are produced. So those products are dry ground. So actually corn meal, if it's enriched, is already required to be fortified with folic acid. Because corn masa is made this different process with lime, it was basically left out of that requirement. And so that's how we have this gap, right? And as has been noted, that means that these households that primarily consume corn masa instead of wheat-based products miss out on this additional vitamin B9 intake that's offered by fortification. So in 2012, a coalition of civil society and industry partners petitioned the Food and Drug Administration to allow for folic acid fortification of corn masa to try to address this gap that we're discussing. After a very thorough review, where FDA considered the safety of adding folic acid to these kind of additional food items, they approved voluntary fortification. Unfortunately, there has not been enough voluntary uptake by industry to see an impact. So we at FFI, we did a supply chain analysis in 2023 looking at the corn masa market, and we estimated at that time that only 6% that was previously mentioned was being fortified voluntarily. So this shows that there's lots of room for improvement. So to try to touch on a couple of other things that have already been mentioned, and please ask the questions again if I miss them, but part of the issue that we have here is there are different types of corn products that we're talking about. So when you mentioned corn fortification, cornmeal fortification, or corn flour fortification being mandatory in Canada, we're actually talking about kind of dry ground corn flour as opposed to this masa process that involves cooking the corn with lime before stone grinding it. So we're kind of talking about a process difference, which results in a difference in standard of identity, and that's why we have this gap. Regarding the question about what is produced in Georgia, I could not give you an exact volume. However, there are, I believe La Banderita, which is a pretty large company, they have a production facility outside of Atlanta, so I know that there's at least a decent amount of production. Mexico actually already mandates fortification with folic acid. So there's not really that concern with imports. I think there's some questions that I missed, but please.
Yeah. Does anyone have a question? Let's see. Senator Eccles.
So Mexico, there is a mandate there. Is there one in Canada?
I don't know for masa, but for corn flour, yes.
So what about the rates of the NTDs in Mexico? Are they lower?
Or Dr. Leopard? Rates of NTDs in Mexico.
Okay. Okay.
That's a bit harder because, yeah, you have to be monitoring to know. So I'm not sure if they monitor or not.
All righty. We good? Okay. No further questions. How long has Mexico been requiring the fortification and their masa products there?
I think at least since 2006.
I'm sorry, you have to come
At
up
least
here.
since 2006. We have
Okay.
the data online on our website, but I don't know
Okay,
off the top
good
of my
deal.
head, but probably about
Well,
20 years.
Good deal. Thank you. Let's see here. Thank you, Ms. Sharon, for your testimony. Who would like to testify next? We've got Helena or Ralph Peeler, Helena.
And may I approach with some show and tell?
Yes, ma'am.
So I just want to encourage you to look at the labels. You'll see they use terms like enrichment.
Hey, yeah, dear, I'm sorry. They if you're gonna have to speak into the microphone, otherwise it's not recorded, and they get on to me. So the floor is yours.
Thank you. Good afternoon. My name is Elena Pachon, and I'm a public health nutritionist. So I think about actions that can be taken at large scale to improve the nutrition of millions of people. The products that I shared with you, we have salt fortified with iodine. We have wheat flour fortified with several nutrients. We have another product, pasta that has been made with wheat flour that's fortified. and then a lemon cake dough mixture that has been made with wheat flour fortified with several nutrients. So today my remarks will reflect my own personal views and not those of my employer. I'm the research director at the Food Fortification Initiative, and I'm also a professor at Emory University. And so I'm pleased to summarize the history of food fortification in the United States and share with you how in the past 100 years through fortification we have been able to eliminate many forms of malnutrition in the United States. So what is food fortification? If I can ask Senator Anderson to lift that bag of wheat flour there. So that wheat flour has been fortified with added nutrients. It's more nutritious because it has folate added to it, iron, niacin, riboflavin, and thiamine. And through food fortification in the United States, we have virtually eliminated many diseases that are due to nutrient deficiencies. They include goiter, which is caused by iodine deficiency, rickets caused by vitamin D deficiency, beriberi caused by thiamine deficiency, and pellagra caused by niacin deficiency. So what I want to do now is share with you a particular story, and I want to take you back to the early 1900s when iodine deficiency was highly prevalent in the Great Lakes region, the northwest of the U.S., as well as the Appalachian region. So there were so many people with enlarged thyroid glands due to iodine deficiency that this region was known as the goiter belt. So why do we care about iodine deficiency? If a pregnant woman has iodine deficiency, it can cause irreversible brain damage and mental retardation in her child, and the repercussions that has for her family, community, society at large. So the Michigan State Medical Society recognized that goiter was preventable if people ate enough of the nutrient known as iodine. So in the 1920s, they engaged with the Michigan Salt Producers Association to figure out the technology to be able to fortify salt with iodine. They also enlisted physicians and school teachers to conduct an educational campaign promoting the consumption of salt fortified with iodine. And so 100 years ago, in May 1924, fortified salt was put on the shelves in Michigan. And the people took it up, they bought it, and they added this salt to their foods. An evaluation found that anywhere between 74% in some counties of Michigan up to 90% in other counties of Michigan saw a decrease in new cases of goiter. So this is truly a public health success. This salt fortification with iodine was taken up throughout the country, and we had our first national nutrition survey in the 1970s. So it was the first time we were able to look at the status of iodine across the whole population. And that survey concluded that the population was iodine sufficient before it had been deficient, and truly this goiter belt was no longer. So I have never seen a person in the United States with goiter, and I think nobody else in this room has as well, and that's thanks to this added iodine in our diet. So in closing, salt is an example of just one of the many food products that are fortified in the United States. Wheat flour, rice, which I did not bring, milk, which I did not bring, are examples of other foods that are fortified to deliver these needed nutrients in our diet. I wish. Food producers have the technological know-how and the experience to produce fortified foods that benefit the U.S. population, and they've done that for us over the past 100 years. Thank you.
I've got a quick question. So wheat flour and rice is fortified with folic acid?
So in the United States, we have, as Sharon mentioned, standards of identity, and we have wheat flour, such as the one in front of us, which is labeled as enriched. If it's labeled as enriched, it must have folic acid. There's also wheat flour that is labeled as unenriched. That one does not have to have folic acid.
Okay. Do we have any questions? Senator Watson?
I guess just to make a statement, I know we've talked about the Latino population in Mexico, but I'm one of those weird gluten-free people that we have a growing population of gluten-free people in our country that also don't get wheat products in their diet. And so just food for thought in this discussion.
That something like rice, for example, could
No
help.
pun intended.
I was wondering about that. I don't know what percentage of the population is gluten free or can't tolerate gluten. And there we go, Chairman Walker.
Point of order.
Go ahead.
Parliamentary inquiry.
Go ahead, Mr. Chairman.
Did my senator from Moultrie say he was weird and gluten-free, or did he say he's...
Well, you know, I live with him up here, and I can tell you he is gluten-free and weird. Gluten-free Oreos are a staple at the apartment, I can tell you that. I'm trying to, let's see, Senator Anderson.
Could you explain to us, does this affect blueberries in any kind of way? We're going to get personal here
Does not
with the
affect
chairman.
blueberries.
Was that what you had? Okay. Where was I at when we had gluten-free? Yes. Do we know what percentage of the population is gluten intolerant?
I do not know. I think it's unfortunately been a craze, and so I think some folks have decided that they may have gluten insensitivities where in fact if they were to be tested they don't. So I think it's a higher percentage who may affiliate with that terminology than in fact actually have the disease or condition.
All right, good deal. We got Senator Hatchett.
I was just going to let you know we did look up if this would impact blueberries, and blueberries are actually a natural source of folic acid. So instead of fortifying with folic acid, we should require everything to be fortified with blueberries.
Would you care to make that amendment, Senator? All righty. Thank you so much. Let's see. Okay, Mr. Ralph? Dr. Ralph, I'm sorry. Yes, sir, I see it there then. Dr. Peeler, who actually, you went to medical school with my cousin's father-in-law, if I remember correctly. Is that right? Or you did your residency together?
Went to residency with Dr. Dennis Thomas in Columbus, Georgia, back in the last century. So,
I understand. Well, we appreciate you being here, Doctor, and the floor is yours.
well, thank you, Mr. Chairman, and I'd also like to give you some handouts here, a little show and tell.
Any cheese toast?
I wish. Now, my name is Dr. Ralph Peeler, and I did my family medicine residency down in Columbus, Georgia with Dennis Thomas and some other good folks. And after that, wanted a little experience practicing medicine in the third world, so I went to Mississippi for 4 years. And then came back here and practiced in Chambly for the last 40 years or so.
Is this the first one?
This is, yes, sir. Chambly's a little bit of heaven. Really, it's more like Mayberry, but anyway. Yeah, I really wanted to thank you all for giving us this time today to explain this subject. It's a complicated subject. I've been around a bunch of Rotary clubs and other groups, and most folks have never heard of spina bifida or have no idea what it is. They don't know what folic acid is. They barely know what a vitamin is. We've thrown an awful lot of technical terms and numbers at you today, and you all have been very patient. This caught me off guard when I heard a fellow come to my Rotary Club a couple years ago. I thought the whole issue of spina bifida had been settled back in the late 90s when the U.S. Food and Drug Administration required the addition of folic acid to enriched wheat products. And so you'll see if you read the label on the hamburger buns, the loaf of bread, wheat products are fortified with folic acid, and that's a requirement by the Food and Drug Administration in the United States. But there was this gap that occurred because a lot of Hispanic folks don't eat wheat products, they eat corn products, and the gluten-free folks eat corn products, not wheat products. So it was determined by the FDA in 2016 that corn products ought to be added to the wheat products in getting this vitamin. You need a tiny amount of this vitamin, vitamin B9. You need about 400 micrograms a day if you might get pregnant. Now, that's 400 micrograms is about 7 grains of salt. I'm talking about just a tiny amount of this vitamin. But a woman needs this beginning about 2 months before she gets pregnant. By the time she gets pregnant and realizes she's pregnant, it's too late. Because, I'll give you a little embryology lesson. When the fetus is first forming, there's a flat plate called the neural plate. And at about 28 weeks after conception, that rolls up into what's called the neural tube. 28 days after conception, that flat plate rolls up into the neural tube. And it requires vitamin B9, folic acid, or folate for that tube to close properly. And if it doesn't close at the top end, then the baby is born with a deformed brain called anencephaly, and all of those babies die. Either they're stillborn, they're miscarried, or they die very soon after birth. There's nothing Dr. Leppard or anybody can do to save those children. If the tube doesn't close at the back end, then you get this open back or spina bifida defect. And that's where the nerves are exposed. Those children will end up paralyzed below the level where the defect occurred. And so Dr. Leppard can do surgery on those babies within a day or so of when they're born, and they'll survive, but they still end up incontinent. They can't control their bowels, their bladder. They have to have multiple surgeries. They may have a club foot deformity and have to have orthopedic surgeries. They can have 15 or 20 surgeries over the course of their lifetime. These are all million-dollar babies. And so we're not talking about preventing a whole bunch of them, because there aren't that many Hispanic babies that are born with this in terms of absolute numbers, but they're very expensive. And probably half of them or more are on Medicaid, they're on the state health benefit insurance plan. One way or another, the taxpayers of Georgia are paying for these children, and it's extremely expensive. And that's just setting aside the misery that these children go through and that their parents go through. So this is really an opportunity, and the reason I got involved with it through my Rotary Club is that this is an incredibly cost-effective way to prevent suffering and also save a lot of money economically. So we'd like to put Dr. Leppard out of the business of operating on these babies. It's extremely cost-effective, and it has the potential to alleviate an enormous amount of suffering at no cost to the state. State doesn't have to pay to do the fortification. The manufacturers know how to do it. They've been doing it in Mexico for a long time. And some of the tortillas that I passed out 2 bags of tortillas. One is already fortified with folic acid, one is not. So what we're asking for in this bill is to level the playing field, to say that if you're going to sell a tortilla in a restaurant or a grocery store in Georgia, that it has to be fortified. And so Kroger can specify that. Walmart can specify that to the manufacturer, whether they get it from Norcross, Georgia, or from Monterrey, Mexico. It doesn't matter. If the end seller specifies that that's what they want, then that's what the manufacturers will provide. It's incredibly easy for the millers and the manufacturers to do this. They buy it, the folic acid and the other nutrients in 40-pound bags. They dump it into these dosifiers. I've seen it operate, and as the flour comes through the mill, it just automatically gets added in the right dosage. So it's easy for the manufacturers to do. Most of them are not opposed to it. They just want a level playing field. They just want to say that if I'm going to do it, I want my competitor to do it. So with that, I want to thank everybody once again for your very kind attention. Don't feel bad about being baffled by some of this. It's taken me several years to really get up to speed on this. Most folks need to hear the message several times before they really get it. But we really appreciate the opportunity to be here with y'all today.
Well, sorry, we got to turn my own microphone on, don't I, Miss Rachel? Doctor, we have thank you for being here today. Thank you for your testimony. Chairman Anderson, you were the first one to light up.
Doc, has it been any effort on the federal level to make this requirement for all states?
At the moment, the only thing that's been done at the federal level is the Food and Drug Administration in 2016 gave permission and encouragement to do it, but not a mandate like they did with wheat flour. So since then, I've got some paperwork that will show that the voluntary fortification of corn products didn't work because there's such a small amount of manufacturer uptake that it just didn't lower the rate of this disease. So it's thought that the mandatory fortification is necessary. The feds have given permission, but they haven't made it a requirement. And as you know, getting anything done in Washington these days is not easy. It's easier to get it done in the states, and if we get 2, 3, 4, 5 states to do this, then the manufacturers will just say, well, we'll make it uniform across the country and do it everywhere, and we don't need the feds.
Good deal. We have Senator Estevez. You have a question?
Yes, Mr. Chairman, a question, comment is what I have. I want to thank the senator for bringing this bill and for taking the lead on this issue and for all the testimony we've heard here today. My stepbrother has spina bifida. He was born with it. I've seen firsthand. He came into my life when I was, I guess, 13, 14, and I've seen how taxing it could be on families. I've also seen how expensive it is and how it's a lifelong commitment, not only for those families but for the state of Georgia. Now, I also, he is white, but I am Latino, so I was not aware that there is an issue in the Latino community because of the diet. So I appreciate the effort to get ahead, or I guess not ahead, and try to fill this gap. And I hope that we could advance this work in Georgia, but also across the country, because it is in fact a very expensive disease and condition, and it impacts families, and as y'all stated multiple times, certainly the state.
Thank you very much, Senator.
Thank you, Senator. I have a quick question. Someone, after we posted that we were going to hear this bill, and when I asked this question, I don't know anything about it, so know that this isn't some kind of gotcha question, because I don't even know what they're talking about. So, but this person called and says that they have the MTHFR gene, which inhibits your ability to metabolize or digest folic acid, can lead to health problems. Can you? I mean, it's just somebody, I don't even know who it was, called into the office, and I'm just asking because I have no idea what they're talking about.
Sure. There are genetic variations. Some people are born with genetic variations for how they process the folic acid that they get from their diet. Folic acid is a vitamin that we cannot make in our own bodies. We have to get it from an external source, from food. And there are some people that can't process the folic acid as well that they take in. And they have this MTHFR genetic mutation. The fortunate thing is that you can overcome that genetic issue by taking more folic acid. But very, very few people know that they have that genetic variation. Pretty much the only women that know that they have that genetic variation is if they've had multiple miscarriages, they've had a baby with spina bifida, they've been specifically tested for it. But The treatment for it is more folic acid, so they would need to take pills in addition to what would be in the diet.
Okay. That's good deal. I had never heard of that, so
Most people haven't.
yes, sir. Do we have any more questions for the good doctor? Well, Doc, we appreciate you coming and providing your testimony. And we are, I think we have everyone, don't we, Rachel? Everyone that's going to testify. What I wanted to do, you want to come up, Senator, and that's what this, I'm trying to learn. Obviously, we all have something that we can learn from this. I think it's a great idea that you brought forward, something that I'd never even heard of. But I am trying to, allow for the members of the committee to kind of digest this and see what the implications are, not only for our fellow Georgians, but also for our food system and what that means, and what if we were to pass something like this, what kind of the implications would be, and cost and all that kind of stuff. So hopefully we can continue this conversation, and I can learn more from it, and hopefully other members of the committee can as well. Be interesting to see. You say that the state of California goes in 26, is that?
January 1st, 2026.
26. All right, good deal. Does anyone have any questions for our dear friend Senator Harrell before we adjourn? All righty, I think we've used up our. Thank you for bringing this.
I appreciate the time to be able to take an in-depth look and really learn about what we're doing here. That's a little bit unusual because we move so quickly. Sometimes we have to move before we have had the chance to learn, and so I appreciate the time you all have given this. I think that it's a tremendous opportunity at no cost to the state to actually reduce state costs. Reduce costs to Medicaid. I visit you all every year and ask you to sign my letter to fund the now comp waivers for home and community-based services. This would reduce, and when you prevent the neural tube defects, it reduces the need for that program. And I would just love to be able to take action on this, pass this bill, and let Georgia be a leader in producing healthy babies.
And I also want to thank our speakers for taking the time to be here today. We as lawmakers and policymakers, we have, everyone here has a different role that we actually make our living at, as far as we're citizen legislators. So for you to come up here and provide the expertise that you have, it is greatly appreciated. And I do want to continue this conversation. I just want to find out, anytime somebody comes to my office and they have an idea of something, I always ask who's for it and who's against it. You know what I mean? To find out what it is. And so we're going to continue that conversation, and hopefully we'll be able to talk with some of our food manufacturers and people like that as well, and try to move the ball down the field with this. So thank you very much for being here. And with that, this meeting's adjourned.
Thank you all.
Thank you.